Good morning, professors, doctors, ladies, and gentlemen. Welcome back, and we are glad to see you again at our third series of the brilliant, unique, outstanding Yuppies BUOY project. I'm Li Ling, alumni MD UKM batch 2016-2021, and also the moderator for today's live forum session. First of all, let me introduce a bit on our project. The Brilliant, Unique, Outstanding Yuppies BUOY project is a collaborative work between Akademi Dr Har and alumni MD UKM batch 2016-2021 that aims to provide support to fresh medical graduates during this challenging time of COVID-19 through virtual platforms. This week, we are gathering here to deeply discuss the current hot topic, which I'm sure all the young doctors are anticipating. The topic of the week is Housemanship Ups and Downs. Let us welcome our distinguished speakers from our very own Hospital Chancellor Tuanku Muhriz. First of all, let us welcome Associate Professor Dr. Farrah Hani Imran, the Consultant Plastic Surgeon. Welcome, Prof. Farrah.
Thank you, Liling. Hi, Prof. Hi, Ray. Hi, Ashraf. Good morning.
Hi,
Good morning. Welcome, Prof. Farrah. Next, we have Dr. Wan Ashraf Wan Zaidi, the Consultant Neurologist. Welcome, Dr. Ashraf.
Hi, thank you, Lily.
Okay. We also have Puan Raynuha Mahadevan, the Clinical Psychologist from the Department of Psychiatry. Welcome, Puan Ray.
Thank you. Good morning, and thank you for having me here.
Okay. Okay, together with us, we also have the founder of Akademi Dr Har, who is also the very important backbone of our project. Let us welcome Professor Dr. Halina Haliza Siraj, and I would like to invite Prof. Har to give a few words. Over to you, Prof. Har.
All right. Okay. Bismillahirrahmanirrahim. Thank you, Liling. Assalamualaikum and a very good morning to all. It's a Saturday morning, and I guess some of you are still, in the comfort of your bed. Okay, but I would like to thank the guest speakers, Farah, Ashraf, and Suri, for making your time. And this is very important actually, and we feel very honored and appreciated, of course. And I guess this is a project where, okay, the third series of four webinars. I was involved in the first one. So I'd like to congratulate Liling, Liran, and June. The other three backbones, so we have four backbones lah, and for efficiently, organizing all this. In the first poster that has been going around, it was actually Prof. Dr. Shahrir, but he has something on. So, and I would really like to thank Ashraf for covering up and making time for us. I'm sure the topic today about housemanship ups and downs, everyone can actually sort of relate to that. And Ray, your input is so important because when they are down, they'll be seeing you. Okay, so when they are upside about, most probably, we can rest assured that they know what to do. But when they are down and down and down, and of course, for Farah and Ashraf, we remember our ups and downs as well, but we have survived. So I think that's the main reason for this webinar. And I really would like to encourage all that participate to sort of comment here. Suffice to just say hello, hi, I'm here, because that's very encouraging actually for those who are in this live stream. Okay. So I think that's all. Have a very productive discussion. Prof. Farah tu tanya betul-betul lah kat dia kan, and don't worry. And Dr. Ashraf as well. Okay, so back to you, Liling. Thank you.
Okay, thank you very much, Prof. Ha. So before we begin our forum session, here are a few housekeeping notes. So today's forum will be recorded to be available for viewing after the session. If you have any questions, please do not hesitate to submit your question through the chat feature in Facebook and YouTube Live. Our speakers will address your questions after the session. So without further ado, let us begin our forum session today. So first question. We understand that house officer is actually the qualified doctor who is practicing under the supervision in a hospital. So in terms of a senior doctor, or should I say from a supervisor perspective, what does a houseman means to you? Maybe we can have Prof. Farrah first.
Yeah, I was gonna say let Ashraf go first, man. You know, I can go last, but that's okay, Lily. First of all, thanks for echo Ray's words. Thanks for having me here. I think before I answer that, Lily, I just wanted to acknowledge that Puan Ray, who you see on the screen, is a very we don't appreciate her enough. I think, Ray, you are one of how many clinical psychologists in the whole of the hospital? Is it 2?
Whole of the hospital down 1, 2, 3, 4, 5, 6, less than 10.
Less than 10.
Less than
Okay,
10.
so
Because the
Puan
ones
Ray,
in Pete's have gone to HPKK already.
okay, yeah. So now you have less than 10. So I just wanted you to whoever's listening to understand, okay, like if you see Ashraf, consultant neurologist, or Hani, consultant plastic surgeon. So most people know, okay, roughly what that's about. But Puan Ray, her job is a very integral part of the whole keeping the hospital going. And I just wanted to appreciate her off the bat, you know, because although we're talking about housemanship, I think it's very important that Prof. Ha and you guys included Puan Ray in this discussion. So I just wanted to get that very clear before I answer your question, because you must know the context before we talk about things. So your question, Liling, sorry. So just to the audiences here, just to let you know, we didn't get the questions beforehand. So none of this rehearsed. Whatever answers you get is like authentic gila, okay? So what is a houseman? It's if you're asking the definition, you've already defined what it is supposed to be. You're still in training. You're a provisionally registered doctor. I'm sure Ashraf will have a more eloquent definition, but you're waiting for your full registration. So the way I would answer your question is that there's 2 ways to think about it, because a lot of medical students will ask themselves, should I stay and be a houseman, or should I quit medicine before? If they're toying the idea of going somewhere else, like as in going into research or going into something else. So usually someone like me will advise you to finish your housemanship so that you get registered, so that you become a fully registered doctor. Okay, because you've gone to 6 years of med school or more if you've had to repeat anything, which is perfectly normal. So why not just go the little extra mile? Okay, and in terms of training, it's obviously a very important part of your training, which has its ups and downs. That's why we're here today. So we can circle back to this later, but let's give Ashraf and Ray a chance to answer as well. Thanks, Liling.
Yeah, thanks a lot, Prof. Farrah. Maybe you can have Dr. Ashraf.
Okay, thank you, Liling. I agree with Prof. Farrah just now. So just touch a bit of the definition of housemanship or internship. So in Malaysia, according to the Medical Act 1971, they are basically provisional doctors. You're a resident medical officer, but this is before your full registration. So you don't get called the full registration yet. So the the thing is, with the houseman, you need to do this program for 2 years. I think this is about 2007, 2008. I think the first few batch where you started to do for 2 years. Yeah. In Malaysia, it's 2 years program. So you have compulsory posting. So I did share with Lily. I need to do some homework because I cannot. I don't know what is the program now. During my time, it's basically I started with obstetric and gynecology. That's compulsory. Then second with orthopedics, surgery, internal the medicine posting. Then we have emergency department, and I have another one is pediatric. I did pediatric was the last one. So the recent program, I was told there's 5 compulsory rotation, and emergency department is become one of the elective one, called join together with psychiatry or family primary care or primary care. I think there's 3 of and another one, interestingly, anesthesiology as part of the final posting, the elective program for housemanship program. So that's the housemanship program. So as answering your question as a supervisor, so I would say we want you to be well prepared. So basically, for example, as a lecturer for you, before now you're a doctor, Dr. Liling. So basically, we want you to be a safe doctor before, right? Now,
Yeah,
we
true.
want you to be the resident called medical officer, the basic one, and you have the attitude to be a safe doctor. Continue doing that. And I hope personally, when I have housemen with me, I hope that one day, with all our guidance, they can be fully registered and they can choose the the specialty that they want. It can be not medicine. Yeah, I think we will share more. But for example, in medicine, I make sure that they have the skills to plug patient. They know how to do basic physical examination, prescription. When you are in the called medical school, you know the medication name, right? You don't know the dosing. But when
Yeah,
you
true.
are a basic called a medical officer, future medical officer, you need to know the basic antihypertension drugs. So that's usually my called exit viva question. Just a simple dosing of antihypertension, and mind you, 70% still didn't make it. So didn't be able to answer the question, the basic one. So that's as supervisor. I hope that will be the called minimum requirement and procedures. For example, I really when I was a registrar, even before junior specialist, I like to make sure that my junior houseman able to do a femoral artery puncture with my supervision, obviously, not called, let them alone without guidance. So then they can survive if they are being called put in Sabah kan mana-mana kan. So they can survive on their own. So that's a few things I can share. I think yeah.
Thank you, Dr. Ashraf. I guess it's very thorough explanation. So how about you, Puan Ray? Do you have anything to share? What do you think, what does a houseman means to you? Yeah.
Okay. Although this is something that I'm not directly involved with, but I can just see from my observation, because like what Dr. Ashraf had mentioned, only recently they've started to do housemanship in psychiatry. I don't have direct dealings with them, but at least I understand from my colleagues, how it works, supervising them. So it's good that they've opened up the options, because I think the traditional one might be the ones that the bigger postings that they've already gone through a lot in medical school. So giving these options of the smaller posting, and there are some that actually come into, like recently we had one who came into, you might also know who it is, came into psychiatry as in it's just a small, elective thing, but who's actually very interested to pursue. So you are opening up the options, for these young doctors. So I think that's good. Yeah.
Yeah, I guess it's a we have a broader options nowadays, and we provide more options for the young doctors to choose from. Yeah. So I found one thing very interesting is that when I search in the internet, there's a Collins English Dictionary. It defines house officer as a doctor who has a junior post in a hospital, and they usually sleep there. It's like, tinggal bermalam kat that hospital. Yeah. So, doctors or speakers, can you please share with us an overview on what are job scopes of a houseman and what does a houseman usually do in the hospital? Maybe we can have Dr. Prof.
Let Dr.
Farrah. Would
Ashraf
you like
answer.
to say
No, no,
anything?
I was going to say let Dr. Ashraf answer first because he's close. He actually did his housemanship in Malaysia. Correct, Ashraf?
Yeah.
Ashraf, for those of you who don't know, Ashraf is a thoroughbred UKM product. Undergrad, right? Undergrad, houseman, pakar,
Yeah.
until now. He's everything in UKM. So perhaps it's good if Ashraf goes first. Then Ray can explain from her perspective, and then I'll type because I did my housemanship, which is called internship in Ireland. But I can and then just sort of compare with what Ashraf says to give the sort of overall perspective. So Ashraf and Ray, off to you guys.
Yeah. Thank you, Prof. So basically, I share called my quite some times already. Yeah, feeling old now. So 14 years ago, I think 13 or 14 years ago, when I did my housemanship, it was already a 2 years program, and called I decided to not to stay in UKM for at least for my housemanship program. So I was in Selayang. So our role, I think, in this specific question from Liling, I think the role and preparation over here when you want to join housemanship is you need to know your job scope. So when I first joined, I joined obstetric and gynecology. So we have called this 2 weeks tagging period. This is the most stressful part, I think, when you are called doing your tagging period. But as Liling mentioned about called the definition just now in the dictionary, is it Liling? So just now, so it's basically staying in the hospital during tagging. Is like you are you are really there in the hospital. So I did my tagging from 6:30 a.m. to about 2 a.m. So yeah, about only maybe 4 hours, 2 hours in the hostel. Then after that, come back again to the ward, to the labor room during that time. Still remember. So, but the reason why I did that, so you can choose not to do something like that, is because of I want to know what is my role as a houseman. So what I need to do, I need to plug the patient coming to the labor room. I need to take bloods. I need to report to the medical officer. Do I need to do ultrasounds? But obviously, as a junior houseman, I just need to be there to chart the findings from ultrasounds. So do I need to conduct labor, right? So and do I need to call do the episiotomy surgery? Yeah. So how to do it? Get to know the midwife, get to know the nurses, get to know all your colleagues over there. Call the anesthesiologist to activate them for emergency Caesar. So those like that are a few examples. So you need to know what is your role when you join the specific department. So if, for example, you think you're good enough, you okay with that, you ask around, you understand, you should have a bit of a few tick box. So you fulfill all the criteria, you think you're competent enough, then you can go back. So I think housemen, you are adults already, so you shouldn't be called asking too much. But yeah, obviously it's courtesy to just say that I am tagging for 2 weeks, so now it's already about 10 p.m. or 11 p.m. I want to go back, and tomorrow early morning I will come back to work. So basically, even though in bahasa is pegawai perubatan prasiswaza, so it didn't mean that you are like learning like when you are undergraduates. You still have a bit of responsibility, although legally it's a bit loose and it's not as being a medical officer. Yeah. So did I answer your question, Liling, so far for the housemanship program? So it's 4 months for each posting. So then if you okay with your posting not extended, then you go to the next program, so to the next rotation. So for example, I did obstetric gynecology. The second posting is orthopedics. Then the next posting is medicine. The next posting surgery, something like that. So you do the 4 monthly postings. So the thing is, need to know what is your role. And nowadays I think the more intensive part is basically about learning. Also during the internship program you have teaching, so I did some homework for the past 24-48 hours. So you need to attend CME, so that's compulsory in your call logbook, and you need to do certain procedure. So those need to be fulfilled, and your logbook need to be reported to your supervisor as accordingly, because of some of the housemen in our center, they come like a week before, and when we assess them they are not fit to go to the next posting, and that will be a bit difficult, putting us as supervisor at a difficult situation. Fortunately not too many, but in some, unfortunately we cannot give a warning, because of we should give a warning before we extend one houseman. Yeah. So but yeah, warning didn't mean we will extend immediately. Yeah. So the first warning, we then tell that okay, you need to back up on this, and what's the reason. So I think as a supervisor, we are not kaki bully, so we are supposed to basically to highlight what are your weakness. So I think depend on supervisor, but my role as supervisors, and now called sharing my housemanship called role and experience before. I think correlating with both is all about how you as adults and responsible housemen in the future. And specific question, Niling, you want to ask?
Yeah. Thank you very much, Dr. Ashraf. I guess it's very well explained. And maybe we can hear from Puan Ray, like from your perspective, what do you think about the job scope of a houseman? Yeah.
Although, yeah, this is something that, like I mentioned earlier, I don't deal with directly. I think Dr. Ashraf has given a very good overview. But just a very quick points. I believe that in each posting that they go to, they have a specialist who's in charge of house officers who will clearly spell out the job scope. So it's about paying attention to that. And if you feel that you're not sure, ask. This is because you're already past that level of being a student. You need to speak more. Yeah. So if you're not sure, ask. Also, yes, job scope tells you what you need to do. Those are like sort of like the compulsory things. But I think it's also the time that you can make use of looking for extra opportunities. So for example, I can only speak from the context of psychiatry. So say they come and do, and psychiatry I believe is a shorter, it's not that 4 months. So they come in, I know they have a lot of things to do, but if say they're interested in say seeing what a psychologist does, that's not part of their logbook or what do you call this, job scope. But if they have the extra time and it doesn't affect any of their compulsory tasks, that's the chance for them to make use of it, because these are times that you don't get back. In future, once they're done and all that, you might not have this opportunity. So I think it's also a time to make use of opportunities without impeding into the compulsory tasks.
Yeah, I'm totally agree with Puan Ray. I guess housemanship itself is not only a job, but it's also a very good learning opportunity for all the young doctors. I guess all of us should be more proactive and always ask if there's any doubts. Yeah. So, Prof. Farrah, would you like to say anything, or Dr. Ashraf, would you like to add on?
Lilin can before going to Prof Farrah, because I can relate to Prof Farrah also. So basically, as
Okay.
Puan Ray said just now, it's very important. It's very important note. If you are not too sure, please ask your call specialist or your medical officer. Sometimes funny things. This is called sharing with all of you future housemen, right? So we are seeing something else, but on the notes is something else because of you don't understand what we are talking about, and you are part of our team member. Please ask. Don't be shy. Number one. And in Malaysia, for example, from what I know, Prof. Farah maybe can share later on. So the opportunity is basically when I was doing my housemanship, lots of procedures, lots of learnings called in terms of skills. You can do it in Malaysia as compared to other parts of the world during my time at least. So because of not many of us during that, especially during that time, like officers, also not too many. So we can do chest tube a lot. You can do lumbar puncture. You can conduct delivery. So many of patients that and called skills that you can learn. So this is the best time now. You are going to be responsible, and there's a lot of skill to learn. Yeah. Then I send to Prof. Farah.
Thanks, guys. So I just want to say that I have notes. Whenever I give talks, I have notes. So, that's why if you see my eyes away from the screen, that's what I'm doing. And in bold, I don't know if y'all can see, is actually the exact same thing that Ray said and Ashraf said, although I said it as don't be scared to ask for help. So that translates, let's just go back to how to answer that. So Leland, you started off this segment by asking about, sharing with us a definition. So to know about that, you have to go through the history of why we have housemanship. So as we all know, we have a dark history where we were colonized by the Brits. So any countries that are within the Commonwealth or under the British system, they would have a variation of such. Okay, so for example, Ireland, for those of you who don't know, Ireland was never under the British per se. Huge history, very colorful history, which is not the topic of today's conversation, but it's called internship there, kind of like the States. Okay, so America and Ireland, we call it internship, whereas Britain onwards, I think now even they've rebranded housemanship to FY, foundation year in the UK. So you said something about staying overnight. So a lot of medical students or future housemen will say that, I'm going to stay overnight in the hospital. Oh my gosh, what kind of life is that? But actually that's where obviously that's just the nature of the job. You have on-call rooms. And you know, some naughty people, that's where they meet their future husbands and wives, because they do naughty things and whatnot. That's just a little bit of humor, but anyway, just to let you know, don't be afraid of staying overnight in a hospital. That's just part of the job. And in fact, you want to stay there because you want to be able to actually be there when something goes off. Goes off means goes wrong with your patients. Okay. In big letters, I put here, know your limitations. And that's just not specific to housemanship. That's actually throughout your whole career. Even in life, not just professionally, but even personally, you have to know what are your capabilities. And that goes back to ego management. But I put that already, it's already been said, but I'm just going to say it because it was in bold. Never be scared to ask for help. And I'm going to say it again, just like Ray did. Never be scared to ask for help. Either when you can't get a line in, or when you don't know how to cope with dealing with certain things, you know, and that can be something that we all think is so normal. Like when I say normal, like a patient passing away. When you care for a patient, when I say care, I don't mean like I sayang the patient. Of course, we all do. But what I'm saying is, like, I'm 44, and even I lost a patient, my team lost a patient, a burns patient, like a couple of months ago. Even then, it still hits you. You know, you're driving, you still feel it, you know, and the day you stop caring about that, you know, it means differently in your development and your existence as a healthcare provider. Okay, so what I'm trying to do is give you a larger context of where housemanship fits in the whole trajectory of your career. Okay, I'll give you an example that you all just saw here today. So you notice how Prof Har mentioned that, okay, in the initial flyers it was Prof Shahrir, and then he couldn't make it, then Dr. Ashraf stepped in. That's a prime example of ego management. Ashraf could have easily gone like, they didn't ask me first, why should I go? I'm not a consolation prize, I'm not a backup, you know, I'm Ashraf, the neurologist, you know. So this is what I mean. Ashraf just was like, oh yeah, sure, I'll step, no problems. But that just shows you that you have a healthy ego management system, that Prof Har has a wonderful program. Like if Prof Har had said, oh, you know, Farrah, look, we had somebody on, but they couldn't make it, can you step in? If you're the kind of person who takes that personally, and the first thought in your head is, why never ask me first? Kenapa tak tanya I dulu? Obviously, I'm less important than the other person. Then it shows that you're not wired correctly to proceed in this line of healthcare. Okay, perhaps in other professions you need to have that kind of egoism, perhaps like in the legal field where you need to go in and be very aggressive, etc. But you know, generally in medicine, despite the stereotypes of surgeons and orthopedic surgeons, aggression should be managed healthily with ego management. Now, I hope that makes sense, because I always like to draw upon what you've seen in real life. Okay, so well done to Ashraf for coming. I don't know whether Ashraf had drama behind the scenes. I don't know if he told Prof Har she owes him Milo Ice for a whole month. That I don't know. But what I can say is the fact that he stepped in and joined 3 ladies this morning on a Saturday morning. I just think it's cool. All right. Next thing is you must have healthy respect for your other professions, because you've heard how Puan Ray and Dr. Ashraf mentioned about on a ward round, say somebody fires instructions at you as a houseman, and you can't capture it all because your pen, you have to write everything down. Then you have the consultant, then you have the specialist, and then you have this senior registrar, then you have the registrar. So sometimes you get multiple different things to write, and they may be conflicting. Always clarify, because at the end of the day, the most important person on the ward round is jeng jeng jeng. Everybody don't answer, but just think to yourself, the most important person on the ward round is the patient. It's not the consultant, it's not the sister, it's not the matron, it's the patient, because anything you do is for the patient, right? For them to get better, etc. So you cannot lose track of that. And if you're not sure, this is in line with what Ashraf said. It's quite funny. I've seen housemen ask patients after the ward round, "Pakcik, dapat tak? Tahu tak apa doktor cakap tadi? Saya tak dengar." Then the patient lah, "Pakcik lagi tak faham." You know, but they're so scared to ask because they don't want to kena bambu on the ward round. They'll ask the patient, and then of course they also ask the staff nurses. So the nurses will say also, "Pergilah tanya, jangan takut," right? Goes back to what Puan Ray said just now. Don't be afraid to ask for help, but you have to improve. You cannot, for the whole 4 months, every single time after ward round, go run to the staff nurse. "I didn't catch any of that. What was it?" You know what I mean? You have to have some form of self-audit where you realize, okay, why didn't I catch that? Is it that my handwriting sucks? Is it that I've got a hearing problem? Maybe you might have a hearing problem. Get your ears checked out. improve your penmanship. You know, there are ways that you address what's your kekurangan, and then you hold up the mirror, see what's your kekurangan, and improve. And that's what Ashraf was saying about the 4 months. That's why you have 4 months in the housemanship. And if you have been advised to be extended, don't take that personally, because at the end of the day, it's to make you a safer doctor. And nobody is going to come and see you when you're a consultant like Ashraf. Hey, Dr. Ashraf, before you see my father, I want to know, berapa kali kau kena extend dalam kau punya housemanship? Cakap sekarang. Nobody is going to ask you. Nobody's going to say, Liling, in your medical school, what number in the class did you finish your final exams? Were you ranked number 3 or were you ranked number 156? Medicine is not the kind that looks at where you are in the totem pole. It's whether you are a decent human being, all right? And this is a very important thing. I've mentioned about respecting all branches. An example of respect is, for example, for say plastic surgery, our patients are in many, many wards. We have burns ward, we have our plastics ward, but sometimes we get referrals, well, oftentimes we get referrals from other teams. When you enter a ward that is not yours, what I mean by that is where you're familiar with everybody, you know the staff nurses, you know the sister. Correct etiquette would be you introduce yourself to either the sister or the nearest staff nurse, because it's their kampung, it's their rumah. Just like you enter someone's house, you just go up. So what I practice in Malaysia is I would say, Assalamualaikum, saya kat sini, kita tim plastik nak tengok ada referral nama ni. Boleh jumpa ke? Because sometimes they might be in the middle of something. Of course, some nurses who might be having a bad day will give you the muka masam poyo and go like, Dr. busy lah, but they won't say it to me, obviously, but they might say it to the junior doctors. But again, don't take things personally. You have to understand, they're stuck in that ward. They can't go anywhere, only for their break for about 10, 15 minutes per shift. They get to go to the break room, you know? Whereas as doctors, we get to walk around the whole hospital. Different kind of busy, but there's different types of mental release, if that makes any sense. You know what I mean? Different coping strategies. So do the whole, even in Ireland, I used to do that. Any wards I went into as an intern, I would check the job list first and then ask the staff nurse, okay, so which one can I do first? Do you want anyone, which particular one first? No, everything's good, Farrah, just fire away. You know? So you have a bit of a check-in system where you're like, we good? Then you fire away. Just to wrap up this point about your question about housemanship is the very important concept, the ups and downs of dealing with different, remember I did this now, the different orders from different people. So even when I was a pakar in training in Malaysia, so this happened to me in Malaysia and different places I've practiced in the States, in France, or in the UK. If I were to even ask Ashraf, like everybody would have different views, where do you cite your IV line? Okay, whether you put it here on the back of your hand or on your cubital fossa. Okay, so these are obviously two very common places to put a peripheral IV line. If you're admitted for, say, cellulitis, you need to have antibiotics, etc. And I've worked with different bosses who say this is the correct one. I've worked with other bosses who say this is not the correct one, go for this one first. So over time, I've realized that the correct way to approach this is the indication of the IV line. Are you only having it for a couple of days versus do you need it for a longer period? Or what is the substance that is going to be going through the IV line? So it's not just as simple as personal preference. So what I'm trying to tell you here is your bosses may not be right all the time. Doesn't mean that you are correct. Don't be an arrogant SOB. But the point is you need to appreciate that differing opinions just make you a better person, because it makes you go off, just like what I just shared with you. You go off and read, educate yourself. Why is this one better? Why is this one not better? Why is this one better? Why is this not better? So it's someone else's personal preference doesn't have to be yours just because they are your mentor. I hope that's coming across clearly. You have to always base it on what is the best practice. And I think that's all for this point. There was a point which I don't know we could cover later, but it's essentially managing feedback and criticism, and that's an important part of ups and downs. Because if you don't know how to manage criticism, and like I go back to ego management, you're not going to go very far. And that's all levels. We have a syndrome, I don't know if you have it in medicine, Ashraf, but we have it called, the new pakar syndrome, you know? So a new pakar is someone who's just finished their specialty. So you need about 4 or 5 years after that to mature as a specialist. You don't become a consultant after 2 years. You know, you have a healthy amount of time where you need to mature in your maturity of thought, your respect for other people, your own decision-making, your own style. So I don't know in neurology how long it is, but generally in surgery, it is and recognized to be about 4 to 5 years minimum. Then you are a consultant. And even then, as a consultant, you must still be able to have that humility that if you see something you're not familiar with, you can ask somebody else and go, hey, what do you think about this? Doesn't mean you're a consultant, you have to, your ego is so hardcore that you cannot ask for help. Okay. And yeah, so I told you about the IV side example, but yeah, the whole new Paka syndrome is very, very real. And so it happens with housemen as well. They finish, they're like, I'm a doctor, I can do this. It goes back to what Puan Ray said. You'd got to ask for help if you don't know. And nothing wrong with that at all. No disrespect. No one's going to think you're an awful person. Yeah, so that's my response to that. Thanks.
Thank you very much for the insightful sharing, Prof. Farrah. I guess the take-home message here for all the audience who are in the live section with us, do not be shy to ask for help, okay? So I understand that the young qualified doctors, they may have some difficulties to getting grip to their new jobs because they have a transition from a medical student to a doctor. So this new role will actually bring new responsibilities and perhaps greater expectations to all of them. So like what Dr. Ashraf mentioned just now, a number of young students are actually having a culture shock, especially when they first enter a new posting. For example, the tagging period, right? So to all the speakers, in your opinion, what are the challenges that a young doctor might face when they first enter a housemanship? And in your opinion, how can they deal with that? Yeah, perhaps we can have Dr. Ashraf first.
Okay. So the culture shock and how to adapt with the first few weeks or first few months of life. So maybe I share a bit of what happened to me then. Okay. So I'm not really a top student. I'm just mediocre. I called okay during my med school. I think just now we were talking about even when you are sometimes you are a very good medical students, and you put the stress too much on yourself. You need to really perform, you know, during the first few months and or few weeks. So sometimes I advise you not to do that because of life is a bit different because of you need to be responsible with your patients. You need to communicate with lots of you're called perangai medical officers, consultants. So you need to adapt with them, and sometimes you will be shocked. You never experience one when you are in UKM. So, so so what you need to do is basically you try to be as much as what Prof. Farah mentioned just now. So try to basically uh, uh, step back and try to not to really be a complainer, that kind of thing. So, for example, just now all the examples Prof. Farah gave. So I would say try to be as much as possible relax and try to adapt with the environment. Get to know your colleagues because of if you know in med school I asked you to do a study group. When you are working, you need to have a group of people, which is your colleagues as your support group. You need to have that. So you cannot be like I call working alone because of you need to prepare yourself. So what happened to me? So I'll get to know my friends in the call in the postings. So try to learn together. So fortunately, each posting I have a few, friends that basically we are about the same seniority. But during my time, I was fortunate throughout the whole posting. There's not much about seniority. We working together. So when we see one of our colleagues is having a problem. So I even did what my other colleagues will do. So for example, I do one round of 28 patients, and then I know my colleagues is not well, so I do another one round. So I have 2 wards being covered by me, or maybe 1.5. So something like that. So we try to help each other. So I think yeah. So that's the thing. Yeah, what you can do. The original question again, Link. So I'll lalu ke tadi.
Yeah, thank you
So
very much, Dr.
yeah,
Ashraf.
I answer right.
Yeah,
Yeah,
yeah. So
yeah.
it's never a one-man show, right? We need the whole team to make the dreams work. Am I
Correct.
right?
Yeah.
Yeah.
Yeah. So
So,
and just another bit of when you prepare with the culture shock. So basically, one of the preparation which is important. Make sure that you are prepared physically and mentally. Mentally, I think Farrah will share later on. Physically, what I mean is basically you need to, for example, put a bit of chocolate maybe in your pocket, something called sandwich maybe. Yeah. No more bag and also a textbook or anything to read. It's more of how to prepare with your work loads every day. So sometimes you don't have time to go to the cafeteria, so and get a bit of called something to re-energize yourself. So those are required. If not, you are too tired. That's when you become very emotional, and you are going to be affected. Your performance will be low. You're very tired. You easily irritable, and also you become very anxious. So those are the things I think you need to do. I myself lost about 10 kilos within the first 1 month as a houseman. So I think preparation, and you need to know that during the posting. Yeah. During
yeah.
our time, we don't have shift system. We on call, so 36 hours called working. I even called my clucking after 36 hours. Placenta become planet. So I don't know what is placenta and planet anymore. Okay, I thought that. Okay.
Okay, thank you very much for the practical tips, Dr. Ashraf. So, like what doctor mentioned just now, the mandatory tagging period could be very stressful for the new doctors. So, I guess this experience more or less will affect the perception on housemanship. So, perhaps Puan Ray, can you please offer some advices to the young doctors on how do they manage this situation? Yeah, any tips for the doctors?
Okay, I think first and foremost, I just want to expand a little bit or add on actually from what Dr. Ashraf said. One thing about expectations, and the other thing is about support. So when it comes to expectations, naturally you go in as a house officer, there will be greater expectations. You're not a medical student anymore. There will be greater expectations from others, but there's also this thing about own expectations, right? So it's important that you manage expectations. So expectations from others, if it's something that you can strive towards, make the necessary efforts to do so. But if it comes to a point that, like Prof. Farrah had mentioned earlier, we all have our limitations. You need to spell it out. You need to speak to your senior or your supervisor or your consultant and kind of discuss this and say that this is something that you just can't seem to come around to it. Maybe they have some advice on how you can get around it. But the trickier one is actually personal expectations. You go in, your house officer, you think, oh, I must know this, and in the end people may not actually be expecting that much, but you put all the burden on yourself, and in the end when it gets too much, you crash. That's where we see people coming in to see us, if anything. So managing expectations is very important. The other thing was support. It is important. No man is an island. Okay, we need support. So in terms of support, it's good. You see, sometimes the idea, I'm not sure if this is right to say, a lot of times, especially in this age of social media, there's this need to be, I must have many acquaintances, many friends, doesn't matter lah, online, offline, whatever. The need to be liked by everyone. That's not important. That's not the most important thing. The important thing is, yes, you need to interact, you need to have support, but even if it's just a few ones, quality ones, that's good enough. So you don't have to have tons of friends, but then when you're in problem, they all run away. Yeah, so interact, have positive, valuable interactions. And in terms of like getting through the posting, it'll be nice if you, like, Dr. Ashraf mentioned, if you have a small group, your sport friends, find time to have some sharing sessions. So when you have time off, sit and just kind of have a room for ventilation, because no one knows it better than those in the system, that your fellow house officers, what you're experiencing. Of course, it should ideally not be a trashing session. You condemn this consultant, you condemn that specialist. Make it a healthy sharing session. But in a way, it's about when you ventilate, you get it out of your system. All right, so that's an add-on. But the way I see it, what's the most important thing? I believe many students, when they are going to enter into housemanship, they've heard a lot of things, right? About whether it's from other doctors, from their seniors and all that. Actually, one of the ways is to get information, what to expect. But what is important is that you always keep an open mind. So you can get this information, but you need to manage this information carefully. The problem happens when you listen to all this and then you already form a bias. When you go in with a bias, that's it. You know, you have set the stage in the wrong way. So collect the information, but enter the posting, each and every posting, with an open mind. Because sometimes you find there's actually hardly like what you heard, you know. So this is something that if you can practice this, it will do well for you, right? So keep an open mind. I think the other important things is that, you know, find ways to release. So if it's not talking to your friends, it can be talking to your mentors. Like all of you from UKM, you have had mentors from before. I think many of them are more than willing to still be in touch and offer a word or two, you know, of comfort. Other ways that can help, you know, is if you can't get somebody to talk to immediately, journal. And then journal, you know, now there's so many ways of journaling it out, as long as there's an outlet for your stresses. Okay. The other part about in relation back to expectations as well is about feeling incompetent. If you don't manage your expectations well, then there's that feeling incompetent. So, and that will create its own set of problems. So that's why it's important to manage, your expectations. Very quickly, I think it's also important that, you know, a lot of times with the long working hours and, it's like just go and everything, there's this lack of personal time and space. So as much as it seems like I cannot find enough hours, I wish there were like 72 hours in one day, you know, that kind of thing. You actually can find time, even if it's in between your time in the hospital, even if it's 5 minutes where you can just step out, get some air. It may seem short, but it can do a work of wonders, because instead of just putting yourself like just all the way without any breaks or time off, it will eat you up. And that's where a lot of times at the end, you know, these individuals, they crash because they become too overwhelmed. So find ways to make time and space for yourself. Okay? All right.
Thank you very much for all the handy tips, Puan Ray. I guess it's very helpful for all the young doctors. Yeah, so from Prof. Farrah, do you have anything to add?
Well, just I think because it's covered quite extensively, I'll just add a couple of sort of real life, what I've observed and experienced myself. So, for example, this touches upon both what Ashraf and Puan Ray mentioned. So when I was a houseman, I rotated through oncology, and I really at that point, I wanted to do either oncology or either 3 branches of surgery. So that's different. There were 3 different types. But, you know, as your housemanship, the beauty of housemanship, it's a non-competitive environment. You're all not racing it's not a pyramid system. Your housemanship is something you all go through together as almost like a marathon. And at the end line, all of you would like to get through. It's not like I have to put Ashraf down for me to go forward, or Ashraf has to like stab me in the back for him to advance forward, which does happen in some toxic environments, which is what I'm going to touch upon in a second. So, for example, when I did my onco rotation, the SHO, which I've been equivalent of a medical officer here, MO, it was like, okay, you're gonna watch me do this bone marrow. So it's bone marrow aspirate for the oncology ward, daycare ward, and then do you want to try? And I'm like, oh my God, I'm a husband. I can't, like what we mentioned, your incompetence. You're first of all, you're like, can I do it? Can I not do it? And then I was like, come on, woman, you're going to be a surgeon. What is it? You know, da, da, da. Anyway, the point is there's a lot of internal monologuing that will go on during your housemanship, but make sure it's healthy monologuing. How do you make sure it's healthy? It goes back to both what Puan Ray and Dr. Ashraf mentioned is it's very easy to know in life what's good and what's not good, right? Like Ray mentioned, don't make a hanging out with your friends a bashing session, because you know it's very simple thing in life. If you can talk bad about someone to someone else, that someone will know that you can talk bad about them to someone else. You know what I mean? If your personality is someone who thrives on gossip, who thrives on something negative coming out from your mouth, that's not really a great way to live. And people will know that about you. They may not say it to your face, but they will know that, okay, this is what Liling stands for. Liling is the type that will carry stories and da-da-da. And it doesn't bode well for your development as a person and as a doctor. And this is throughout housemanship and paka and onward. And then you do get toxic people. So in your housemanship, you will have some patients who, nothing to do with you personally, but will just hate your guts just by seeing you. Okay, maybe they don't like people with junk boots. So they see Ashraf coming, they're like, get this guy away from me. Get me a non-jungoted doctor. You know what I mean? And that happened too. So when I was in one of the late night calls of internship, I went to a ward, like I think 2 a.m. A guy needed an IV line in the vascular ward. And it was a very elderly Irishman, probably, never grown up with, very sexist, what we would call sexist, but he was never used to seeing women are nurses, men are doctors. So when I came up to do the IV line, before I even touched him, I said good morning. He says, I won't do an accent, but he just said, get out of here, get me a male doctor, right? So I was like, okay, but I'm the doctor covering this ward, and I'm okay, I can in your line. He didn't want to hear any of that. He just wanted a male doctor. So at that point, you can choose to be offended and do, I have 6 years of medical school, I know what I'm doing. But no, this patient has his right as well. Okay, so he wants to say that. So what I did was I just went back, just told the sister in charge, listen, your man there doesn't want a woman doctor, so let me just ask one of the guys if he'll come along. So that's one way to diffuse a situation. You don't want to fight with somebody 2 a.m. in the morning. You're not going to change someone's lifetime belief at 2 a.m. in the morning. This is something. So these are things that what I'm saying as housemanship, you have to appreciate. It's not just you. It's not, you are part of a larger system, and you need to respect the dynamics that go around on how you navigate that. So all I did was I chatted to, there were 2 other guys on with me that night. So I just called one of them. I said, hey, Jerry, this guy doesn't want, oh yeah, he's a real a-hole. So, and what we did was we swapped jobs. So he said, okay, I'll do your gigs there, and then I'll clear up what I can here. And then if you can pick up whatever I've left behind in this ward. So we just swapped wards. So I went to his ward and cleared up all the, clerking or whatever that was to be done. And he went there and settled everything. So I'm not saying that's the only way that was the best solution. It was a solution. Okay. Another solution would have been, I go with this guy, and Jerry would sit there with this guy and say, this is not how we should behave. Let her put it in, but those is what I'm trying to say. And there's a time and place for everything. So I hope that example makes sense. Also use your housemanship as a time to do courses and exams. I think both Ray and Ashraf has already touched upon that, because nowadays there are a lot of courses like ACLS, ATLS, psychiatry equivalents that allow you to do courses as a houseman. Like GCP, those of you who don't know, good clinical practice, if you do it now, I think it's valid for life. Ashraf can correct me if I'm wrong, but this is something that you'll need for research, and it looks good on your CV as well. So educate yourself on what courses and exams are relevant to you. Following on from what Ashraf said, how you equip yourself when you're a houseman is very important. Puanray has mentioned about how you equip yourself internally. Ashraf has mentioned about the chocolates. So what I used to do was I had a what you call a waist bag. Some people call it a fanny pack. So I used to have the particular sutures that I know I'll need. The plaster that goes on top of it. We call it a tegaderm or whatever it is, because sometimes you go in the ward, they don't have the stock. So then you're like, oh my God. And you can't marah the staff nurse because, they've got their job. So I always had a little pack ready to go. So like a little bit like a ninja, you go in the ward, you're like boom, 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 boom. And then you go to the next ward, boom, 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 boom. You're not wasting time assembling a tray, so it's how you manage yourself. And I only knew that because that's what I saw my colleagues doing. And we told each other, oh, that's a good way to do it. Some guys, of course, wouldn't be caught dead with a bag because that's a band bag, right? Not everyone's Joey from Friends. But the point is, you do what you do to get by. Ray mentioned about sitting, the whole sort of discussions and all that. That's why the importance of the res or the common room is very important. So say you've had a rough sort of incident, you go sit down, you make a cup of tea, your buddy comes along and you're like, oh man, this patient is such and such. Then they'll say, oh yeah, no, I had problems with that person too. So you have a camaraderie. The key point here is there's a camaraderie, but it's not based on slashing or demeaning other people. So that's probably another whole session on how to deal with criticism. But I just want to highlight also what was mentioned, which was managing expectations, make sure the support is healthy, and please make sure you understand that there's no shame in seeking professional help. Look at lovely people like Puan Ray that are here. I can tell you now, there are lots of consultants and pakars, Ashraf will know what I'm talking about, would really benefit from counseling or meeting people like Puan Ray, but they don't because our system, our healthcare system, our culture doesn't allow for it. You know, there are many consultants in other parts of the world who openly admit that they have bipolar, they have other things, and they're actively seeking help for it. And that's just part of life. Mental and physical health is just equally as important. But Malaysia, we have to work on that a bit more. So yeah, so I really hope the generation listening here doesn't have that stigma, or it reduces the stigma. You know, I'm just gonna turn off the camera for a second because my battery's gonna die, and I'm just gonna change location. So I'm not leaving. I'm just turning off my camera. Okay. All right, Liling, that's it for me for this thing.
Okay, thank you very much, Prof. Farrah. I guess a very important point here is that mental health and physical health is equally important. Yeah, so we all know that for our batch, MD UKM batch 2016-2021, we are still waiting for our housemanship. Yeah, so in the meantime, we have some time to relax before starting the new chapter of life. So in this waiting period, is there any suggestion on how can we equip or prepare ourselves beforehand? So perhaps this time we can have Puan Ray first.
Okay, thank you, Li-Ling. I think like what I had mentioned earlier, similarly to before entering a posting, get yourself prepared, get information. But like I mentioned, keep an open mind, try not to find a bias. The other thing, I think the other ways of preparing yourself is reading up. You know, you don't stop. You finish, you graduate. I know it's been years of reading and preparing and all that, and you just want to chuck your books. But you know, you don't have to do it like in the sense like I'm going to read for an exam. Make it leisurely, but you pick up, and it doesn't just have to be from books. It can be from online, or you know, watching videos on YouTube, things that just to keep you how do you say on track, so that you don't lose out on any knowledge. If there are chances to practice, if you happen to know you have connections with doctors in the hospital or whatever, and you have chances to practice your clinical skills, grab it. It is a time to take a break, but you can still find a little bit of time to do all these little things. Yeah. Sometimes it's about also like getting out of touch. Like I think now the opportunities are wonderful and I know like yourself also doing RA in a hospital. So you have not left the hospital scene. But for many, some maybe they choose to go back to their hometowns and there isn't this much opportunity, and some may end up doing jobs because they need to earn an income and they get out of touch from that, the whole hospital scene. Sometimes something as simple as just getting into the scene from time to time, like just going to a hospital, just stepping into a hospital, just getting the feel of it. It may seem like something very trivial, but it can make a difference so that you're not parted from that scene. So when comes time to do your housemanship, you haven't like left the hospital scene too long. So these are some of the ways. And another thing I think that is important is that what you can do is, with the information that you gather, create like a plan for yourself, how you're going to manage yourself when you become a house officer. What maybe know your limitations, where you need to improve, how you think you can manage if you're faced with difficult situations. So you have this little blueprint for yourself, so you don't go in like unprepared, or you don't have. It's good to have these little tools, to go in with. So then you're more likely to be all ready when the time comes, and not like, oh my God, it's time to apply and I'm not ready, that kind of thing. So these are some things I think that would be helpful. Yeah.
Thank you very much for the suggestions, Puan Ray. Perhaps Dr. Ashraf, would you like to add on a little bit on this?
Yeah, so yeah, to be honest, it's not easy to advise you on this because of during my time, we only less than a month or two, we need to report ourselves to respective hospital. We go for the induction program, and then we continue with our housemanship program. So, but looking at what I have encountered when I was doing my fellowship, some of the called junior doctors. They decide from the beginning. So what you want to do, because of I think I saw the last few episodes. So I think Prof Fauzi I think mentioned about, yeah, in Malaysia we graduated a bit older. I think it's a year or two older compared to other part of the world. So then now we have a problem about recruiting the houseman. So it take a year or two, or maybe it's not more than a year, I hope. So if you decided to do something already immediately, so maybe all the other panel have different call opinion. I think what I saw is basically you need to be brave enough. So if to begin with, you decide not to be a clinician, then you should then decide from there to just join maybe a call master program of science, then go to a PhD program immediately. So be brave from that moment. Is very very important to decide immediately. So other things that you can do, what Liling did, so preparation, so become a research assistant, or maybe keep in touch with few of us. Then we can do some called posters, called case reports, maybe short studies. Nowadays, lots of survey we can do. There's a lot actually of advancement that we can still do some research, especially yeah, you all from UKM, right? So we can do that, do some research, get a publication, uh, get a call experience with conferences. So then hopefully that will be inside their resume in the future. Yeah. So those are the things that you can do. If you decided for a call, I think we discussed. I think maybe not with Conway, but with our other faculty members before. So there's a students that asking us, okay, why not? She take another 2 years to do a master program in Harvard. So if you get the offer and you think that is the opportunity that you want to take, why not? Because of I believe if you really really good, if you come back and you still want to go for your internship program or housemanship program, it shouldn't be a big problem. So just as what we discussed before, take it step by step. You know what is the expectation, and try to get the necessary help. So I think it can be done. That's my advice. Preparatory.
Thank you very much, Dr. Ashraf. I think all of us should take this time to plan ahead and think properly what should we do in the future, right? Yeah, so how about you, Prof. Farrah? How should you think the young doctors should utilize this waiting period? Yeah.
So you mentioned planning ahead. Now the key word here is for you to plan ahead, you must know yourself. So knowing yourself also means that you understand that you are an evolving process. So all four of us here, 5 years ago, we were different people. Similar, I mean, what I mean by that is our values, core values and beliefs are most likely the same. But we evolve. That's the beauty of life, that we evolve, we grow. Some people, and it goes both ways. Some become not very nice people. Some people evolve to become better human beings in universal service to our communities. So going back to what, again, both Puan Ray and Dr. Ashraf said, now I'm of the opinion that there's no wrong thing to do. Whatever you do that brings your development professionally and personally, that is your correct thing to do. Okay, let me give you an example. A person who works in H&M or Zara, what do they learn? They learn the skills there. They learn people skills. They learn how to interact with non-medics in a professional settings. They learn what is an EPF. They learn about what is a business sense. So there's different skills which we don't learn in medical school. And I'm sure in psychology also, Puan Ray, you probably never learned business acumen. Like if Puan Ray decides tomorrow, I've had enough of UKM, I'm going to set up the best therapy center in Kuala Lumpur. But we don't have entrepreneurial training. Basically, we're not trained to make money, right? Because our profession, I mean, I'm of the belief that once you start bringing money to it, it's easy to get seduced and lose your way a little bit. But that's just my opinion, right? Which is why I'm still in public service, like Puan Ray and Dr. Ashraf as well, But There are skills. If you decide to be a Grab food deliverer, a Grab driver, no shame in that whatsoever, because there's skills there that bring you to make you a better doctor. Conversely, doing exactly what your colleagues are doing, becoming an RA, that gives you insight into what actually happens in day-to-day functioning of teams. What you guys see as a medical student is outside looking in. Yes, you are part of the team. Yes, you are part of the ward rounds, but you're not part of the discussions that go on. You're not part of the OT, the cases. You don't come in for all cases. You just watch. But to actually do, and what I mean by do is when you make mistakes and get scolded, or when you do something right and nobody cares that you've done something right. So actual day-to-day functioning of the team, you get a little bit more insight when you do clinical attachments or you do our research positions. So that gives a different kind of insight and a different kind of skill. So you have to decide. So say now you're in final year, you've just finished, and you think, Cow, I want to be neurologist. 100% I know. Why? Because I had a crush on Prof Raymond last time. Now I have a crush on on Dr. Ashraf. Or maybe if you're a boy, I have a crush on Dr. Nafisa. I'm just saying, because sometimes that's what entices us to a specialty, is we admire the person. Not so much the specialty, but the qualities of the person. And of course, if the person's a bad person, that pushes you away from the specialty. It works both ways. But the point is, say you already know in your core belief that you love neurology, you have family history of Parkinson's, so you know later on in life, having a grounding in neurology is going to be great. Okay, then you should be thinking that about doing an attachment in neurology, doing something that's relevant. Neuroscience, not just clinical neurology, as Dr. Ashraf mentioned. Clinical is not the only way to go. I really want to make sure all of you understand that. We are all tuned that a doctor means somebody who's in a clinical setting, means seeing patients in a hospital. That's only one tiny part of medicine. Doctors work in labs, doctors work in pharmaceutical companies, doctors work as advisors. There's a huge amount of things that you can go into. You can give up medicine altogether and become, I don't know, assistant to Tony Fernandez and work for AirAsia and have nothing to do with medicine. Okay, which people do. They give up, they do an MBA, become business people. So to go back to your question, Liling, is I would say to all of you is spend this time to get to know yourself, because you're not having exams. You don't have the pressure of exams. Your life right now is you and maybe family pressure. You may have family pressure, apa ni, every day sit down, not doing anything, pergilah keluar do something. Maybe you have family pressure at home, like, wow, you sit home, propping up the couch, get out of there and do something with your life. Point is, it's a year and a half, I think a year, Liling, you guys wait for about a year before you get your posting now? Is that the average waiting time now, Liling?
Around 6 to 9 months, yeah.
Okay, so in that 6 to 9 months, like I mentioned earlier, there are courses, there's stuff that you guys can do, but it's a beautiful period to stand, and you can get there by doing all the different things that you've heard this panel talk about. And again, nobody can tell you what's right or wrong. If it works for you, then that's great.
Yes, thank you very much, Prof. Farrah. So think ahead and plan ahead. All right. So a warm reminder to all the audience who are with us today. Please feel free to drop your questions in the comment section, and our panelists will address your questions shortly. So back to our forum. So people always say that housemanship resembles a roller coaster ride. Of course, there are times that we feel contented and rewarding, but there are also times that make us feel down. So let us move on to another heavy topic about workplace bullying. To me, this term is like a taboo. Yeah, we hear whispers about it behind closed doors, but never in the open. So to all the speakers, what do you think about workplace bullying? And to you, what is considered as a workplace bullying? Yeah. So perhaps we can have Dr. Ashraf first.
So definitely this is a topic that you need to be prepared as you go to the program. Liling. But yeah, there's a lot of possibilities. So when you are being oppressed by whether your boss, it can be the consultant, specialist, medical officer, even with your own colleague. So you need to be well prepared. So example, uh, I hope, yeah, maybe my colleague will be laughing because of, I think we become a good friend afterwards. So what happened in one of the posting, I remember I was doing my tagging. I'm the senior poster, but I thought I want to rest a bit and not to show off that I know what to do. So I saw that my junior colleague being bullied every day. So at 5 o'clock, he need to settle all the other co-workers called tasks. So that's one of the example of being bullied. So as so then called the one that will suffer again, as what we discussed, is actually the patients. Lots of our colleagues, including the nurses, are our colleagues. So we don't want to make other people having a problem, right? So as called person, so I was the senior one during that time. Although I'm not a medical officer, uh, yeah, what you can do is I now share with you how I handle it. Is basically talk to the person that basically bullying us during that time in a nice way first, hopefully. Then call, then tell them, look, this is not acceptable. Why is the reason? So okay, so and yeah, sometimes yeah, people won't take it as simple as that, because of in reality you can yeah, if I were to remember back, yeah, it's quite a drama. But when people get to know you, if you really talk to them nicely, especially at your level, at your own level, houseman to houseman, you talk nicely. One day they get to know you're sincere. You're not called you don't called advise them because of you hate them. You just want to advise them so that they can be part of your team member. Again, the team member is very important. So call then in later part of your journey, you become good friends. So that's why I told you. So yeah, no name should be mentioned, but I remember yeah, during that time I need to yeah, help my colleague, and then also inform my other colleague that yeah, this is not acceptable. So, but from my experience, yeah, yeah, I really hope there's no more consultants or specialists bullying or called in any way to the junior doctors, because of when I was as a houseman, we are really helpless. We don't know what to do. There's a lot of politics, so we go to the medical officer. Medical officer cannot do anything, and going to the specialists and consultants, obviously, uh, depending on the seniority, they cannot do anything also. So as a called specialist now, I would say um, we always advise our colleagues that we need to be fair. We shouldn't in any way call implement any call any bullying in our fraternity. Yeah? So touch a bit just now we discussed. So for example, I when I first as a junior specialist, I was called put as the person in charge of few housemen, and I need to, after I assess them, I need to extend them. So I need to know why this happened. So why the housemate is not performing so well. So sometimes yeah, we investigate. The houseman really unable to cope because of their seniors bullying them. So you understand. So those are the things that can happen. So as I mentioned to you, when I was a bit junior, I don't really like that called environment. It's a very toxic environment, so we shouldn't have that. So as a senior, so we go down and advise the medical officer and hope things can change. Yeah. So and if everything is okay, for example, certain housemen they really need times. So as a specialist, I'm not comfortable also to say that okay, I need to extend you. When I look each one of you, each one of my housemen, I know they are called a son or daughter to somebody. I always treat my own called team members. They are called parents, or father or mother to a child. Understand? So it's very sad for us to do that. So there's a lot of points I need to show to the houseman why they need to extend. So it's not easy for me personally. It's not easy uh, those days. So nowadays a bit I'm more involved with fellows. So fortunately, it's less stressful. From the supervisor point of view, also stressful, you know. So I'm not happy to do that. So, but going to touch about bullying, I hope personally, if you have any problem, I hope there's more and more counselor, psychologists that can really help the junior doctor, even the senior doctors, because of sometimes this still happen. But yeah, maybe we can listen to Prof. Farrah and Puan Ray, how we allow much more open system for complaints and a proper investigation without called further repercussion to the juniors, because of sometimes they really scared because of when they want to report bad things happen to them rather than they get called something uh, a fair called judgment to what has happened to them. So that happened during my time. So I hope, yeah, within my called, specialty and my department, we hope we never do that again.
So that's great. So maybe for this, I'll continue for this link because I think this one is a topic which Puan Ray would be the great wrapper-upper because after getting input. Is that okay, Ray? I'll just go quickly and answer. Yeah. Okay. So first of all, you mentioned bullying. Of course, yes, it's a taboo topic, but it shouldn't be. It should be something that can be openly discussed. However, be aware to not be a reverse bullier. So don't use bullying as an excuse for your own agenda. And I'll get to that shortly. First, let's understand what bullying is. Bullying should be spoken in context of three concepts: bullying, discrimination, and harassment. What do I mean by that? So in life, and especially in medicine, the dialogue that goes on today is, first of all of us need to know our hak dan tanggung jawab, rights and responsibilities. I'll repeat that. We need to know our own rights and responsibilities, hak dan tanggung jawab. And there's lots of references out there, lots of resources out there. Our other speakers have mentioned mentors, previous mentors, current mentors, and bullying happens at all levels. Okay, why I say that? I'll share with you my experience. I had a wonderful internship. Like, it was very well supported. It was only 1 year in Ireland, but the point is great camaraderie. Of course you get one or two things. Then I had great surgical training, which is the SA years, FO years. I mean, like, there was no complaints, none of this issues. It did happen, doesn't mean it doesn't happen. No, so that's a key concept. Just because something isn't happening to you doesn't mean it's not happening. I'm going to say that again. Just because something is not happening to you, you yourself are not being bullied, you're not being discriminated against, you're not being harassed. If someone comes to you and says, Ashraf, can I just have a chat with you? I'm going through this and I'm sure how to deal with it. Ashraf turns around and goes, Farrah, it's all in your mind. That means that just because he hasn't experienced it, you can already see that's not a correct supportive environment. Okay? Say if Ashraf goes, okay, I've not experienced it myself. However, I know someone else who did. So why don't I put you in touch with that person? Or why don't I put you in touch with Prof Har? Because maybe she's being a woman, might have been through the same things you did. So that's what a supportive friend does. Nobody is going to solve your problems for you. So let's go back to that again. When you are going through something and you're confiding in someone else, you're not looking for the solution from that person. What you need to know is that you are going to be equipped with the tools to deal with it yourself and take the next step. When you go and see Puan Ray for counseling, you can't say, Puan Ray, tell me what to do. I don't know what to do. Puan Ray cannot say, I'm going to pick up the phone and call your ketua jabatan and tell them that what's going on is wrong. That's not Puan Ray's job. And that's not her. That's why I go back to rights and responsibilities. Puan Ray will probably advise you, these are what the steps can do should you choose to take it. You can be supported at this level in this way. At this level, this will be supported. What I mean by support is you can meet somebody who's in a position of power or position of authority, not power. You chose the wrong word there. Position of authority, who can say, vouch for you, who can say, I've witnessed that. Okay? And when it comes to bullying, harassment, discrimination, bukti or proof is paramount. Okay? Why do I say that? It's because if there's no need for bukti, everyone, you don't like someone's face, you'll start saying, that goes into slander. That goes into dengki and fitna, which also occurs. So that's where I go back to the reverse bullying. So all these different factors, we have to understand how they're interconnected and how they interplay with each other. Like, it's very easy to tell if somebody's genuine or not. Like, if I sit down in front of Puan Ray and I say, Ray, I want to report sexual harassment by Ashraf. Okay, so straight away in that first sentence, I have said the person's name. Ray, as an experienced person, will know that's probably a little bit like, why am I trying to get Ashraf? You know what I mean? If I truly did experience it, I might phrase it differently. I'm not going to tell you that because then everyone's going to start using the same language. But what I'm trying to tell you is people like Ray, it's not easy to become a clinical psychologist. It's not easy to become a mentor, but there is training where they find out whether you are actually going through it, and then they offer you the kind of support that you didn't know even existed. Okay, so what I'm trying to say is don't go. If you're going through something, ask for help. Conversely, which what Ashraf mentioned, don't be the kind of person who makes up stuff, which does occur, to get things to work to your advantage because you don't like somebody. And that unfortunately happens in medicine. Now, our job as so-called senior people is to recognize bad behavior. Sometimes if you're middle management, even if we escalate Ashraf would know what I mean, if you know somebody's problematic and you bring it to a higher authority, their response might be, this is beyond my pay grade. I nak buat apa, tak boleh buat apa-apa. Kita start like that. So I get very frustrated with the tak boleh buat apa-apa response. And actually it's not their fault because that's the system. All right? So that's where you need to recognize how to proceed from there. And that goes back to knowing your rights and responsibilities. Another important thing is knowing where you are for how long. So housemanship, the beauty of housemanship is you're only anywhere for 4 months. Even if you're extended, it's what, Ashraf? Is it a couple of weeks? Is it 1 month? Is it? What's the maximum someone can be extended?
Nowadays, very sad. The extension can go up to 3 months.
Okay, all right. But that's a good thing as well, because if you need to, right?
Yeah.
And the thing is, sometimes people actually do need to because they're unsafe. So I would agree with that, all right? However, if there is a genuine cause for concern that it's someone's a victim of bullying, that's why they're being extended out of malice, then again, there are rights and responsibilities. There are pathways where it can be reported. And then there's an inquiry, there's a panel that can be called upon. You know, so that there's actually layers about this that people don't know about. Okay? But what was I gonna say? If you do not bring it to attention, then that's the problem. Don't suffer in silence. So my advice is, if it's for 4 months and it's a little bit difficult, weather it out, because after the 4 months you're going to go elsewhere. Like, for example, when I was very close, like, to my intern and my surgical training in Ireland, that whole group, we were all very, you know, as you go through your there's no competition element. I come back to Malaysia, I enter the Masters for Plastic Surgery, and that was a different environment. So what Ray mentioned earlier about having a study group and a study system. So in my master's, it was quite an isolating experience. I was close to a few seniors, and as they graduated, I became like a loner. But the point is, you still survive. You don't have to have an army around you to survive. But that goes back to knowing the kind of person you are. So what got me through my master's was knowing I will come back to UKM, which is my kampong. Because I knew, okay, if people are competing for cases, which is operations, that's fine. Because I know when I finish, I'm going to go back to UKM and that's where I will be thriving. That's where I'm going to make sure I do everything right. You know what I'm saying? So again, it's to do how you view things. You know, how you view things. You can be depressed and go, oh yeah, I got no friends. Nobody want to friend me, you know, which is very common, right? It's very easy to feel very lonely in life. It's like preschool or primary school. Oh yeah, I don't want to friend that person. Why? Because they, you know, maybe come from a certain background. So like, for example, in my final year of master's, and I say master's as an example so that I share with you housemanship, there's a lot of parallelity between any training environment, whether you're training as a houseman, you're training as a pakar, you're doing a fellowship, there is commonality. So in my final year, the guy I was, one of the guys I was studying with actually said to me, I want to say I'm sorry. I said, for what? But, you know, when you first came into the program, you know, we just knew you as, you know, you come from UKM, you know, not like us from KKM, and then you're the former gymnast, so we thought you're very prasan, full of yourself. I was like, fuck's sake, pardon the language, I was just like, FF sake. I was like, you know, just because I kept to myself, people misconstrue that, right? And I wasn't like, when I asked, oh, what textbook do you guys use? Nobody told me. Nobody wanted to share. I had to go to the Siswaza department to get the printing list. This is adults, when my training. But when I look back now, I realize, yes, it was lonely that I didn't have a BFF, that I went through my master's training with. But that's fine, because at the end of the day, it made me a better person and it made me so much more independent. But yeah, so back to this guy, he apologized. I'm really sorry because I think he said something to the effect of we didn't treat you very well. And I just like, yeah, that's fine. So I don't think but it was very nice that he made the effort to apologize, right? Just as we're about to take our final exams. So, okay lah, forgive him and say, never mind lah, what's gone is gone, let's look to the future, And I just want to say very importantly I don't know if these type of people are watching progressive sessions like this, but exactly like what Ashraf just said, if these words come out of your mouth, do you know who my father is? Do you know who my mother is? I boleh call aja I punya bapa. Kalau nak extend I, tak apa. So if this kind of mentality manifests in your mouth and is something that you say to someone, you need to check yourself and ask yourself, why are you saying this? Is this how you're navigating through life? That means you're not enough by yourself, that you need to really highlight, it's such abhorrent, awful behavior. Awful behavior. Okay, I'm saying this because there are some in medical school would say it to some extent, but it manifests very clearly in housemanship. And that's where what Ashraf was saying, those who are supervisors, that's not something, a person who's ethical, that would matter nothing. But you get calls from higher ups that will say, oh, this person is related to so-and-so, that should have no bearing on the kind of doctor you're going to be. So check yourself now and do not have such crap coming out of your mouth, because that carries you through life. People will know that that's the person you are. In medicine, it's quite insular in that way. And for goodness sakes, please don't get your parents to call up your head or your paka. This is not preschool. And that happens as well. You get people who say, hey, my daughter is, wanted to have this Sunday off. Can you give off? I mean, come on. You're getting your parents to sort your life out as a houseman. I mean, I wanted to say no words, but I'm sure there's a word for this. So remember, I go back to the very basic, okay, to answer Liling's point of this question of bullying. Very two simple concept. One, as I mentioned earlier, was you have to know yourself. You have to know the kind of person you are. Learn to understand yourself. And number two, rights and responsibilities. And in bracket number 3, don't be an entitled a-hole. Are we clear? Don't be an entitled, nasty specimen. All right? You are you. Be amazing with you. All right? You don't have to be, I'm Raynuha, daughter of, MIC chairman, therefore, or pengarah KSN negara or something like that, So, I'm saying? You're Raynuha. That's it. You know what I mean? Okay. That's all. That's my little ceramah motivasi for this for this bit. All right.
Thank you very much, Prof. Farrah. Such a nice sharing. Yeah, Puan Ray, would you like to add on anything?
Yeah, I was floored by Prof. Farrah. I just love how she sends things across. I think both Dr. Ashraf and Prof. Farrah have given very valuable input. So I'm just going to add just a little bit. I think when you talk about bullying, I'd like to think that 98% of the time it is real. But there's this other small percentage that is very much based on perception. So for example, if you are doing your housemanship and then a senior nurse tells you, maybe in a very firm way, you need to do this, this and that, and you consider that bullying, most likely it's actually not. It's something that you needed to do, and it's told to you in that way, but maybe from where you're coming from, maybe how you were raised or how you just went through life, you see that, oh, this shouldn't be happening to me. And that's perception. So sometimes it may not actually be bullying, it could be a matter of perception. But I would agree that at least 98% of the time it's real and something needs to be done about it. Expanding on the rights and responsibilities, which is very, very important. A lot of times, I think sometimes even we ourselves, we don't know our rights. So when things happen to us, we tend to keep quiet, And I like the point that Prof. Farrah made. If it's not happening to you, it does not mean it's not it doesn't mean that it's not happening. That's very true. And also, what together with rights and responsibilities is also knowing your personal boundaries. What might be okay for one person may not be okay for you, and that already is an indicator that your space has been invaded and you need to do something about it, right? So from maybe, for example, for one person, all these silly crappy jokes that sometimes can get a little bit not very clean, can be okay for some people, but for you maybe no, this doesn't work for me and I feel very very uncomfortable. So that's knowing your personal boundaries, and you need to act upon it, take necessary action. But I think a lot has been said about what needs to be done and all that. I just want to highlight this one point. Using the proper channel. We understand that now in the age of social media, it's very quick to this thing happened to me. I go on my Facebook and and a lot of times, sometimes people, I know the younger generation, they don't filter. So without them realizing it, very key identifying information will come out, right? And what happens is you need to understand how this works, because we had this experience, and maybe I think Prof. Farrah and Dr. Ashraf might also know this, that things put on social media about being unhappy and they're going to do something and everything, but not channeled to the proper channel. So, but what? Once things go up on social media, they go viral, and then it goes around, and then the issue comes that even if, say, the situation is very genuine, okay, the person is in a crisis, or the person is in distress, but how the person went about it makes them already kind of lose that position of like, we want to help you. It's like, it becomes like this, they put it out there, and then like, we want to help, it's like, yes, we want to help, but why did you have to do this? And so for some people it's like, do we even want to help you because you went this way? So be very, very mindful. Use the proper channel. Find out how to do this. So most likely, as a house officer, you would bring this up. Maybe, I don't know, they've mentioned already the pathway. So find out the pathway, go through it. And at least, you use the proper channel. The other thing is, you must remember this, and that's the reality of life. Sometimes when we go through these pathways, whether it's in your housemanship or even outside in everyday life, you may not always get the best outcome. But just know this, you have done the right thing. So at least if it didn't work for you, just say, you got bullied, and then you followed everything. It went to the pathway, it went to investigation and thing, and then the next thing you know, nothing happened. Tiada tindakan diambil. Of course, you will feel disheartened and very upset, but at least you did things the right way. And know this, that even though there was no favorable outcome, the thing is already out there. So in future, people will be a bit more mindful about their actions, and hopefully this thing doesn't repeat. So don't think about, okay, I do this means I must get an outcome. As you know, a lot of cases out there, as we can see for ourselves in our country, there's no favorable outcome, but you let the process take place. Yeah, the important thing is using the proper channel. That's it.
Thank you very much, Puan Ray. I guess the take-home message here is that know yourself, know your personal boundaries, know your rights and responsibilities. Yeah. So here comes the very last question, and perhaps is the heaviest question here. Yeah. So years and years, we are still hearing the very real issue about quitting housemanship. So I believe that is a very tough decision to make, and it must have gone through a lot of considerations. So to all the speakers, in general, what is your opinion on quitting housemanship? Maybe you can hear from Dr. Ashraf first.
Yeah, so I start first. Then I call the other two experts who will be very, very good in terms of answering the point and summarize for me. So, from my point of view, quitting housemanship. I think one of the called advice that I received when I was called in med school, Prof. Mahaya told me, basically, medicine, Liling, medicine is only part of you. You are not medicine. You understand? So basically, being a houseman, being a doctor, is not called 100% of you. So you are still a daughter to your parents, right? So I'm a son to my parents, and I'm husband to my children, and I call it to my wife, and so I'm a father to my children. Understand? So I have a different role in life. So I think if you finally decide, yeah, if at all there's a reason, find the reason. What is the reason you want to quit housemanship? Then I think you should make it wisely. So, for example, as I mentioned before, I think we in Malaysia sometimes I can see the culture is we are not too brave to make a decision. So why? Maybe Puan Ray can share. Maybe there's a research on that. Uh, uh, when you decided that okay, I actually went through med school. Fortunately, for 5 years past, because of this is my parents' wish. But I want to be a scientist. I want to be involved in called maybe developing the new vaccine. Okay, so you don't need to do housemanship. You don't need to join the housemanship program. You decide. You say then okay. I don't want to be. I don't want to suffer the housemanship program. Okay, it's not about housemanship program is causing suffering. It's time wasting. You have your ambition. Go for it. Understand? I give a different example. You want to be a singer or maybe a YouTuber nowadays. So why not? Just go for it. Just go for it and don't join housemanship program or not. Yeah, if you report, then quit immediately. If you think that is the best thing for you. So discuss properly. Look at the prospect. What do you want to be? So I think it is not something that you should be called like saying that oh I'm making a wrong decision, so I will make a wrong decision. You need to go and meet the ketua kampung to decide on this decision to quit housemanship program. I don't think so. But yeah, I hope parents, if any parents listening, they should also listen to their children. Yeah. So because of it's all about your future. Yeah. So decide it properly. You're already adults. I told you you're a bit like a year or two more older compared to your colleague around the world. You can do you can make a wise decision. Yeah. Okay, Lynn. That's I think my sharing to you.
Thank you very much, Dr. Ashraf. I guess it's very, I need to agree with the point that you are yourself and you know what is the best for you. So medicine is not the whole thing about your life, but you need to sort out what is the best for you. Yeah. Perhaps Prof. Farah, do you have different point of view regarding this quitting housemanship?
Okay, so it goes back to again what both of you said, which is knowing yourself. Now, but then that extrapolates into at the age of you finish medical like Lily and gang, you guys are what 23, 24 now, right?
We are
25?
25.
Oh, yeah.
Yeah, we
Okay
are
lah.
25.
Sorry. I'm forgive me. I'm a couple of decades older, so I forgot how old I was when I started. So sorry, but no. Again, this we shouldn't be ageist. You could finish medical school at 30. Who cares? You know.
Yeah.
But the point is, at that point in life, do you know what's best for you? Because first of all, is following on from what Dr. Ashraf said, is making a decision like this, you talk to people, but at the same time, it's not a survey. You don't go around saying, hey, should I quit? Should I quit? Should I quit? And you ask everyone in sundry. The Ketua Kampung example was hilarious. But the point is, you ask your grandma, you ask your kitty cat, you ask your doggy, Chomel, I'm not happy. Should I quit housemanship, Chomel? You know, this is what I mean is this is a very real thing that happens to people because when you're conflicted in life, any conflicts in life, generally you seek other people's opinion, right? That's what people say because inherently society has some amount of judgment on you. If you quit, oh, bazir duit ma ibu, bazir duit rakyat hantar you to medical school. So there's the guilt that is put upon you. But again, that goes back to knowing who you are and reconciling that no, it's not a waste because I'm going to bring this knowledge that I have, the skills that I learned as a doctor, into the world of the laboratory in lab science. If it's not even science, I'm going to take up social science. the beauty of, I think, life is collaborations and cross-linking, that we don't just exist in silos. Ashraf, for example, works very closely with neuroscientists. There are people who are not medical doctors. There are people who did biochemistry, because he deals with a lot of stuff going on in the brain. As a plastic surgeon, I work very closely with psychologists. Or even my PhD is something that's actually more social sciencey, but that's because I saw the value of it. But to some people in my profession, surgeon means surgeon. You don't friend with other people, surgeon only, and then you get people like Prof Har, who really tries to highlight the importance of how we all should coexist and respect each other, and actually we develop better together. This sounds like a political slogan. It's not, it's a fact, okay? As a profession, we do much better when we understand others' profession, and we really, actually, medicine is such, we complement each other. Back to your question about quitting. I think that's the wrong word. I think it's really, you don't quit something per se, but what you do is you just happen to modify your trajectory, you modify your direction of life. Because quitting has a negative connotation, that you tried something and you failed. So it's rebranding the failure, because you're not failing to go through something, you're just choosing to do something else, But there needs to be a very real conversation with yourself about regrets. If you do not finish your housemanship, you are not a fully registered doctor. I'm going to say that again. You're not a fully registered doctor. What does that mean? The consequences of that means, if in life you come into hardship and you want to do locums, say in a GP clinic or locum anywhere, you cannot. Correct me if I'm wrong, Ashraf, but you need to be a fully registered doctor. You need to be fully registered with MMC, etc. So if you're partially registered or provisionally registered, what do they call it, doctor? Sorry, provisional registration is the English version. I'm not sure what the Bahasa one is, but you have your medical degree. So your medical degree and fully registration is the completed product. If you have your medical degree without this thing, you're still a product. You just don't have the full registration. So you need to know to yourself, what does that mean to you? What does that mean for you? Okay? When you make any decision about changing hala tuju in life, you need to make sure you do that without regret. When you look back, you don't want 5 years from now and go, oh my gosh, I should have been at that panel, the BUOY panel, and listened to what the panel said, No, this panel is not telling you to go either way either. But I share this from a very personal space, because I have been trying to complete my PhD for the longest time. Okay, so PhD is a little bit like housemanship, because you deal with a lot of judgment and a lot of criticism of your decisions or whatever, right? So anyway, in addition to the last while, I've also been dealing with my own experiences of bullying, harassment, and discrimination, which is something we can talk about some other time. But many times in the last 3 years, I've quit. And I say this very honestly, without shame. I've wanted to quit this PhD because I thought my life is on hold. I haven't seen my friends. Because when you're like now, you'll be feeling guilty. Oh, I should be doing my PhD work. So anytime you want to rest, that like when you're studying for exams, you want to relax, minum teh also, like, I should be studying right now. You play with your kitty cat also, you're like, I should be studying right now. You have that guilt, eternal guilt. Point is, I know what it's like to have that conflict of wanting to quit. What happened for me was I was reminded very organically by life, either by medical students, by colleagues, by mentors who just happened, I might bump into the corridor. Maybe I bump into Ashraf in the corridor who would say, hey, how's your PhD going? How's this going? And somehow that manifests as motivation. They don't say, Farrah, don't give up. Because I don't actually say, I want to give up. Nobody's going to come and say, Liling, don't give up your housemanship. Don't be so stupid. No. But the point is, if you are in tune to how the universe functions and how your place is in the universe, it's a bit advanced, but your thinking has to be open. You remember how Puan Ray mentioned about going into life, going into your housemanship with an open mind, without you have your expectations. That is so true. And I don't know how to, in this short forum this morning, we can't really explore that, but there's such beauty in that when you tune into what is happening around you, you realize, you know what? If I quit, I'm gonna be, I'm already so close. And you know what's happened now, and I can share this here. I was gonna actually tell Prof Ha separately, but my thesis has just been approved supervisor, and now I'm waiting for my viva. But to get to this point was a very difficult point for me. And I was like, when I found out, I was like, yeah. But it's just, even now saying it to you guys, I've got little elation inside, because it's so, Ashraf would know, but anyone who's been through a pitch would know what this point is like. This is what I'm trying to tell you. Don't have that regret. I could have quit and I would have been happy, but I'm a little bit happier that I'm at this point. So if somebody wants to quit housemanship even before entering, I feel you've not given yourself a shot. And that's coming from my perspective. I repeat, my perspective, okay? I've shared with you what I've gone through. So my advice is, give it a go. Give it a go. And then if you really think it's not for you, you can look back and say, well, you know what? I gave it a shot. I experienced it. I knew it was not for me. Halas, habis. And now I can go with a clear conscience into another field. As opposed to, I never really tried it. Oh, maybe if I tried it, I wouldn't have found it so bad, because your buddy's going to end up being consultants. Your buddies are going to end up being GPs. And you have, somehow in life, there's that little bit of a comparison devil that always is at the back of your mind, So you'd be like, dang it, So I hope that's given you a few different options to explore of how that applies to the listeners, how that can apply to you. So I hope that makes sense. All right, now we given Ray a lot to to summarize there, but anyway, I'll pass it on to Puan Ray.
I think both of you have covered all the points. But anyway, very, very pertinent points. And okay, let's take it this way. The decision is a personal decision at the end of the day. Yes, you make it with a lot of evaluation, a lot of thought, and doing necessary. I mean, like, if there are problems, try to see how you can overcome it. It should not be a decision that is made impulsively. That's the bottom line, right? And also, when you decide that this is not what you want to continue doing, there should at least be a rough idea about what's going to happen next. Because there are those who, they just can't take it and they just want to let go. I'm being very mindful of using the word quit, because Prof. Farrah said that's not actually the right word. So at least have a rough idea, so that you don't want to be put in this position where after you decide, okay, you've let it go, and then you're there, in a very redundant state for an extended period of time. That's going to create another set of difficulties and problems. So like what the both of them have said is, know what your options are, all right? So that know that there are other options. I like the point about not defining yourself as medicine is you or being a doctor is you, because there are so many aspects, facets of ourselves. We should not just be defined by one single thing, right? But I think the real red flag where should be the one that kind of drives people towards this decision is when physical or mental health is compromised. Then something is not quite right there. But even so, you need to at least find ways to get help. But even if after everything it doesn't, you just know this is, your heart is not there, or this is not the right place, and you just can't go ahead with it, then that's where you choose to walk away. But I think that point by Prof. Farrah, don't decide before you even attempt anything. At least give yourself the opportunity, because once you look back, you can't get back the time. Yeah. And at the end, I think this is, I think for mainly the students, the medical students who are listening and future house officers, it's more of your own experience. But if there are anybody else listening in, when a person decides, I'm not going to go through with this, I'm going to let it go at this point, please don't judge them. It's not your position. It's their personal choice. Don't judge. Or even if it's your friend, say you are going and then your friend says, Liling, no lah, I think I cannot lah. After 2 posting, I cannot tahan already. I want to quit. Don't say, oh my God, don't put a judgment on them, because a lot of times we make that judgment without knowing the story. So just be very mindful of that. Yeah.
Thank you very much to all the speakers for sharing with us your personal experience. And I think it is very valuable for all the young doctors. So I guess now we are towards the ending. So before we end, any suggestions or any take-home messages to all the young doctors? So Anyone?
I just want to say this one thing. I know this whole thing is about housemanship's ups and downs, but in your journey, don't forget to live. Okay, you don't want to look back and say that, oh my God, I didn't live. Life is not about just existing and going through the routines. Yeah. So remember to live. Remember about balance, and give your chances to learn and explore. That's my take home for everyone listening.
Yeah, I agree with Farrah. Um, Basically, yeah, think positively. So, housemanship program is the points where you are going to be you going to gain more experience and to become a better doctor. Yeah. So and at the same time, enjoy it in terms of like, okay, it's not all about just working in the hospital. After your not your shift, everything, go and enjoy movies, catch up with friends, families. Yeah. So you should enjoy as usual. So the I would say it's a myth. It's a myth that you don't have life during your housemanship program. For me, it's not like that. I still have life, but yeah, I can enjoy with my son when I was doing my housemanship. Go to the with them and enjoy, watch movies, and yeah, and have some fun with them. So it's not really that you don't have life, you cannot have fun. You should enjoy it. Okay, learn call slowly, carefully. Uh, you have to call the you have we have a system where you should be able to go through this program. So I still believe the system in Malaysia still there for the young doctors, that you should be able to go through this safely. Uh, yeah. Okay. Enjoy housemanship program soon, I hope. Okay.
Okay, thank you, Dr. Ashraf. How about you, Prof. Farrah?
Um, again, echoing what the other two have said, but also I just want to add that the thing about not being judgmental also extends to geography. What I mean by that, if you get posted or your friends get posted to somewhere that is not happening, and a big town like KL, PJ, JB, whatever, Penang, there is you actually learn more in smaller centers. You mature more, you get more opportunities. But some people who come from big cities, there's a huge I wouldn't say stigma, prejudice and bias, as Ponray mentioned earlier in this session, which is ridiculous. So some people, Allah, I dapat Sabah, I dapat Sarawak. Hello, I would be jumping for joy if I got Sabah or Sarawak. I mean, do you know how awesome Borneo is? You know what I mean? But people have this mentality, and then if you're Sabahan Sarawak, of course they're happy to go home if you're Sabahan or Sarawakian. But this is why you have programs like Sarawak for Sarawakians, where people want to break off because there's such a disconnect between Semenanjung and East Malaysia. And in medicine, that's echoed. People have this huge thing. Allah, I dapat Terengganu. Allah, I dapat Kelantan. I've worked in Kelantan for 2.5 years, and that was the best time, because the Kelantanese people are wonderful. Well, they were to me anyway. And even, you learn to catch a latte with this kind of face. It doesn't go, audio and visual don't connect, but it's just a fun experience. So again, I go back to what you make of life, and you get to know you must know who you are. So Ray, your Ray's point was about, what was your wrap up point, Ray? It wasn't about judgment. What was it? Because my point was a little bit building on your point. What did you say just now, Ray? See, getting already forgot.
About living.
Yes. Okay. Thank you so much, Ray.
Not
Yes. Thank you. Yes, that's right. So first of all, you have to live. You don't just survive life, you thrive, right? So we all need to thrive in life. And so again, I'll just use personal example so that you know it's legit what I'm saying. I wear many hats. So most of you, before you were born, I used to do sports, but even now in my daily life, I have different hats that I wear. I'm not, as Ashraf said, I'm not just a doctor, a plastic surgeon. I have many other things that I volunteer for. And that rubs people, some people see it wrongly, that, oh, that's a wrong thing. You're a surgeon, you be a surgeon. And that was one of the issues that was related to what I experienced in the last 3 years. So people who are a little bit different, like me, who are wired a bit differently and think out of the box, sometimes you're not celebrated, you're attacked. In different environments, if this was the US, this was Ireland, it'd be different. I'm not saying it's perfect there. They also got their own pros and cons. But people like Prof Ha, you see Prof Ha has set up this academy. Prof Ha encourages people to diversify, you know, but you can speak to Prof Ha. She would have had her own challenges. As Ashraf mentioned, he's not just a neurologist. He has other roles that he plays in his life. Same with Puan Ray. I have no kids myself, but my husband works in Ireland, and he, you know, we're in a PJJ, Perkawinan Jarak Jauh. So that comes, you know, we miss each other so much. He's my BFF, but I'm serving my nation. He's serving his nation. What I'm trying to tell you is don't let people define you. Okay, but it goes back to my 2 key points that I've consistently said throughout today's morning session: knowing yourself, understanding yourself, allowing that you will be an evolving entity, and knowing your rights and responsibilities in order for you to navigate being a houseman through the ups and downs. I hope that makes sense. Put a little ribbon on top with my last sentence there. That's it for me. Thanks.
Thank you very much to all our speakers. I guess to sum up, to all the young doctors, live your life, enjoy your life. After all, the housemanship ups and downs, hopefully we can all able to sail smoothly. So once again, our sincere and deepest gratitude to all our speakers for spending your beautiful Saturday morning with all the young doctors here. It's our honor to have all of you today. The words of wisdom that we had will definitely shed light on the real issues on housemanship and motivate us to sail further. So ladies and gentlemen, thank you very much for joining us today. Please continue to support us and tune in to our last series on next Saturday, 30 April, same time at 10 a.m., same platform at Facebook and YouTube, Akademi Dr Har. We will have doctors from different fields to share with us the topic, pathways of specialization, what's the update. Thank you, and we will see you in the last series. Have a wonderful weekend, everyone. Goodbye. Thank you.